Autism Spectrum Disorder. So many of you must have been wondering what this autism is. You must have seen an autistic child before, and it's brought so many questions and so many concerns, and you keep asking these questions. What is autism? What is the cause? Can it be cured? How can I help a child with autism? Okay, so let's get right into it as I answer some of your questions about autism spectrum disorder. So firstly, I'll tell you what autism spectrum disorder is. Autism spectrum disorder is actually a neurodevelopmental disorder that is characterized by differences in communication. Yes, it's characterized by differences in social communication and repetition or restriction in behavior. Okay, so that is what autism is. So many people see autistic children and they're feeling like, no, don't touch me. Maybe if an autistic child touches me, I may get infected or something. No, it's not an infection. It's not as if their sweat touch you no, it is not. It's a neurodevelopmental disorder. Okay, so there are key facts I'd like you to know about autism. Autism affects 1 in 36 children. It affects 1 in 36 children, and it is prevalent it's prevalent in boys, like 4 times more prevalent in boys. Then autism, there are no two individuals with autism spectrum disorder that are alike. No, you can't see John, an autistic boy, and let's say Caleb, another autistic boy, and say, okay, that's they are alike. You can never see that. Okay, so there are no two individuals with ASD, autism spectrum disorder, that are alike. Okay, now I would like to tell you the different levels of autism spectrum disorder. There are different levels. So when you are helping a child with autism spectrum disorder, you need to know their levels so that you would be able to know the level of help you should render and what this child really needs from you. Okay, we have different levels. We have the level 1 means that they require support. They require support. Then the level 2 is that they require substantial support. That is level 2. They require substantial support. Then level 3, they require very substantial support. So you see, so you need to know the level of autism or the level a child falls into, an autistic child falls into, for you to know how to help the child. Okay, so a child that requires very substantial support and you are giving the child just support, of course you wouldn't be able to help this child properly. Okay, so the 3 levels of the autism spectrum disorder: 1 requiring support, the second one requiring substantial support, and the third one requiring very substantial support. Okay, so let me explain these different levels to you. Level 1, requiring support, you see mild symptoms. Okay, you see very mild symptoms, and you see challenges in social interactions. In their social interactions, you are going to see that they have challenges. Like in social, you can see an autistic child, other children are playing, and this autistic child will just go and stay. Most times, would I say that they enjoy their own company? They just want to be on their own. They are always isolated, something like that. Okay, so an example is you find out that they have difficulty adapting to change. That they have difficulty adapting to change. For instance, when you have given a routine in your home, okay, you have given a routine in your home, and once you try to change the routine, you find out that they may throw tantrums. You find out that they are having difficulties adapting to the new routine. Okay, so they usually have difficulties adapting to change. So the second level is is requiring substantial support. Okay, here you will notice marked deficits in communication. There are marked deficits in communication. okay? And some of them can be preverbal. They're marked, just know that they are marked deficit in communication, and they have restricted behaviors. Okay, for instance, explaining this, let me give an example. You see them struggling with non-verbal communication. For instance, when I give this sign, when I give this sign to a child, of course we all know it means come, right? But that autistic child in this level 2, some of the autistic children in level 2, when you do that, they will just be looking at you because they don't really understand. They don't understand. Or maybe they're with you and you are like, it means go. Okay, go. They won't understand that. So that is non-verbal communication. Verbal is when you speak, when you give out your word. Then non-verbal is like sign languages they don't really understand. Okay, this reminds me of when I was younger. Then when a visitor comes to our house, our home, and the visitor is in the sitting room with my mommy, and when maybe my mommy wants, okay, yes, my mom would want privacy with her visitor. My mom would just look at you. She won't say anything. She won't blink. She won't do anything. Just the way she would look at you. You already know that I better leave this place now. But of course, a mother can't do that type of. You can't speak that type of language to an autistic child under the level 2. Okay, you can't communicate with the child that way. Or maybe you start doing like this. No, the child won't understand, may not understand. Okay, so they usually have struggles with non-verbal communication. Then the level 3 is requiring very substantial support. They require very substantial support. Now you see very severe deficit in communication. You see many of them would be preverbal. Many of them would be making maybe tics or making some sounds, and you see extreme difficulty with their daily functioning. They have difficulties with putting on their clothes, even using the restroom. They can't say, please, I want to use the restroom. They will see them having so much extreme difficulty with their daily functioning. So that's why they fall under this level 3, that they require very substantial support. Okay, for instance, you will see they will have this high repetitive behaviors. They are all over. You see the high repetitive behaviors, and you also see their resistance to change. They have this very serious resistance to change. Okay, we are still trying to get this child to be able to follow this routine, and then you are trying to change the routine. You will see they will have very high, they will start throwing tantrums. Sometimes they may even have a meltdown. Okay, so these are the 3 levels of autism spectrum disorder, and I've told you what it means. I've told you key facts about autism spectrum disorder and levels of autism spectrum disorder. So please stay right with me as we go on a little break, and this little break will take you to my next video. Please be around with me, because in my next video I'm going to be telling you the categories of symptoms, and I may be able to tell you how to help these children at different levels. Okay, children that are different levels. Please stay right with me as I tell you more about autism spectrum disorder. Thank you very much for choosing to learn with me, and thank you very much for giving me your time and attention. Take care. See you in my next video. Bye. Please don't forget to subscribe, like my video, and please share. Okay, please share. We are trying to help mothers, we are trying to help caregivers, teachers, just trying to help them know how to help these kids with autism spectrum disorder. Please, let's spread the message. Let's spread this good news that, oh, finally we can get knowledge about learning about the autism spectrum disorder. Thank you very much.